Hello everyone. Today we'll talk about a very important topic in gynecology, that is tuberculosis of the female genital tract. So it's TB. As we know, TB is a major disease in the developing world and countries like India, so it's an important topic. So TB of the genital tract is almost always a secondary infection, because primary infection being in the lungs. So the tubercle bacilli, it affects the lungs, and from there, through various routes like hematogenous route, that is via the bloodstream, or the lymphatic route, or there can be a direct spread to some organs also. So there are various ways of spreading, but almost always it's a secondary infection in the genital tract, and primary infection being in the lungs. Now this tuberculosis is a very important cause for tubal infertility and menstrual abnormalities in the developing world. So because now what happens is that this TB of the genital tract, the most common part that is affected in tuberculosis is of the genital tract is fallopian tubes, and in the fallopian tubes, ampullary portion is the most commonly affected portion. Now the reason for this is that ampullary portion has the richest blood supply, and the most common spread from lungs to the fallopian tubes is via the bloodstream. So the infection spreads via the bloodstream from the lungs into the genital tract, and the fallopian tubes, the ampullary portion of the fallopian tubes having the richest blood supply, are the most commonly affected part. Now, whenever there is involvement of the tube in some infection or inflammation, so after inflammation there is healing, and healing is always by fibrosis. So as we know, TB is a chronic infection, and chronic infection, then there will be healing. In chronic infection, this inflammation and healing goes on simultaneously. So there will be healing, and healing is by fibrosis, so that will lead to destruction of the tube. And if this spreads to the endometrium, obviously when it spreads to the tube, and from the tube it goes to the endometrium also, the infection goes to the endometrium also, and it affects the endometrium. So there is destruction of the endometrium. But what happens is that since the endometrium is shed every month as the menstrual flow, so the infection does not spread to the myometrium. Okay, but since the endometrium is affected, so therefore there are menstrual abnormalities also. Okay, because the shedding of the endometrium is a major part of the menstrual cycle, so the menstrual abnormalities are also there. So the two major problems that arise with the genital TB is the infertility due to tubal factors and menstrual abnormality. Okay, so this was the introduction. Now let's move on with the organism. The etiology is, we all know, it's Mycobacterium tuberculosis is the organism that causes genital TB. And now it is very rare, because earlier it used to happen, Mycobacterium bovis used to cause TB in the GI tract, but because now the milk is pasteurized, so this disease is very less common nowadays. But if it happens due to Mycobacterium bovis, it is almost a secondary infection from the GI tract. Okay, so mainly what you have to remember is that Mycobacterium tuberculosis is the causative organism. Okay, and then it is almost always a secondary infection. The points that let's just revise the points that we have discussed. So it is almost always a secondary infection, with primary site being the lungs. So lungs are the primary site, and from there via the hematogenous route, which is the most common route of spread, it spreads through the genital tract. And in the genital tract, it affects the fallopian tubes, and the fallopian tubes it affects the ampulla, because ampullary portion has the richest blood supply. And the uterus is also involved. Okay, in 80% of the cases, the uterus is also involved. And in uterus, the cornua, because cornua is just adjacent to the tubes, so it is very much involved in genital TB. Now looking on to the pathology. If we look at the pathology, so first we'll look at the macroscopic appearance of the fallopian tube, and then later we'll talk about the macroscopy of endometrium. So what happens in the fallopian tubes is that there is three types of inflammation that can take place, or there are three places in the fallopian tubes where inflammation can take place. There can be endosalpingitis, there can be interstitial salpingitis, and there can be exosalpingitis. Okay, so very obviously, if the infection is coming from the adjacent organs, it will cause exosalpingitis first. Okay, if the infection is coming via the blood route, then it will cause endosalpingitis or interstitial salpingitis, because that is the place where the blood vessels are present. Okay, so blood vessels are supplying the fallopian tubes in the interstitium or in the endo part of the fallopian tube, so it will the inner wall of the fallopian tube. So that is the place where the hematogenous infection will cause inflammation. Okay, so if it is from the adjacent organs, it is exosalpingitis, and if it is from the bloodstream, the hematogenous route, it will cause endosalpingitis or interstitial salpingitis. Okay, now what happens once the tubes are affected? Suppose there's because as we know that the most common route of spread is hematogenous, so we will talk about this route only. So there is an infection via the hematogenous route which is caused endosalpingitis. Now itis is inflammation, and we know the cardinal signs of inflammation are there will be redness, and there will be edema, and there will be this exudation will be there, as there are there is this rubor, Galler, Dolor, and Functionaliza. All these are the signs of inflammation. So this is what will happen in the tube also. The tube will get inflamed. Okay, the tube will get thick and edematous and red in color because of the erythema. What will happen after that? And then there will be, because it's a chronic it's a chronic inflammation, so there will be healing also, and healing is by the fibrosis. Now when there will be fibrosis, when there will be fibrous tissue, so that will cause tubal block or the formation of adhesions. Okay, that will ultimately result in destruction of the tube or the blockage of the tube, and this is the reason which plays a role in infertility, in causing infertility in TB of the genital tract. What else happens is that if there is exosalpingitis, so if there is exosalpingitis, the outer surface of the tube is inflamed, and then also there will be healing by fibrosis, so there will be adhesions where there will be formation of tubo-ovarian masses. Okay, there will be formation of tubo-ovarian masses, there will be adhesions all around the tube, there will be adhesions between the tube and the ovaries. Okay, so these are the kind of adhesions that will be taking place. And if you look at the ovary, see, if the infection is in the ovary, so the ovary is covered with tunica albuginea, and because it's a rigid kind of a membrane, it's a protective membrane which does not allow the infection to penetrate into the ovarian stroma. So the infection is present, if in ovary it is present only on the surface, and which you can diagnose with the help of seeing tubercles on the surface of the ovary and also the caseative necrosis. If the infection is in the endometrium, so endometrium is studded with tubercles. Okay, so endometrium it has tubercles all over it. It has tubercles. Now these tubercles, they will damage the endometrium, there will be ulceration of the endometrium, and when there will be ulceration, then again there will be healing and there will be fibrosis. That fibrosis will lead to intrauterine adhesions, and this intrauterine adhesions, what it will cause is, it will lead to secondary amenorrhea. Okay, moving on to the clinical features. What will be the symptoms? How will the patient present? Usually the patient is between 20 to 40 years of age. Okay, and see, there will be some general symptoms or the constitutional symptoms which are seen in some kind of inflammation, like fever. There will be fever, there will be malaise, and there can be this sense of weakness in the patient. then it will affect, there will be menstrual abnormalities. Okay, menstrual abnormalities will be there, and there will be amenorrhea. Why there is amenorrhea? Amenorrhea is due to the formation of intrauterine adhesions, because there was destruction of the endometrium that was taking place, which had resulted in the intrauterine adhesion. So there is secondary amenorrhea, and there will be infertility also. The patient most likely is infertile because of the tubal damage that has taken place, because of the tubal block that has taken place due to fibrosis and the damage that has been caused by the inflammation. Okay, and if there are lesions in the cervix or vagina, that will lead to blood stained discharge. Okay, and one more thing is that because of so much inflammation is happening and so much healing and fibrosis is happening, so there will be adhesions all around in the uterus, or maybe around in the pelvis, you can say. So there will be pelvic pain, there will be chronic pelvic pain because of these adhesions. And these adhesions can also lead to, gradually in the later stages, can lead to frozen pelvis, a condition which is formed due to excessive fibrosis. Okay, and so let's recapitulate the symptoms. There will be general symptoms. The patient is usually between 20 to 40 years of age. There will be general symptoms like malaise, low-grade fever, pelvic pain, and menstrual abnormality. There will be amenorrhea. Amenorrhea is due to intrauterine adhesions, and it is also due to the destruction of the endometrium, and it is also due to the weight loss, which is associated with TB, and the general health, the ill health which is associated with TB, because we know that if there is a chronic medical problem, it can lead to amenorrhea in females. Okay, there will be infertility. Infertility is due to tubal damage, tubal block, or maybe sometimes in exosalpingitis, as there are peritubal adhesions. So these peritubal adhesions can lead to kinking of the tube, that can hamper the movement of the ova, that it can also result in infertility. And there can be ascites if the abdomen is involved. There can be ascites in the abdomen. Okay, and if there are local lesions in the cervix or in the vagina, it can cause blood stained discharge. What are the signs of this disease? The signs are, first, there will be general signs of TB such as weight loss, there will be fever, and there will be lymphadenopathy in the cervical nodes and the iliac nodes. And if the abdomen is involved, there will be a typical doughy abdomen. Okay, so doughy abdomen is typical of abdominal TB. Then there will be hydrosalpinx and tubo-ovarian masses. Okay, on pelvic examination, one can feel tubo-ovarian masses or hydrosalpinx. Now, why there is hydrosalpinx? Because there is, as I have told you, that there will be infection which is in the tube, as well as spreading to the endometrium, mainly the cornua. So cornua will also be involved. So if there is a cornual block because of this inflammation, and if there is, there is inflammation of the tube, that can make the tube as an enclosed chamber or an enclosed pipe. Because if there is inflammation and fibrosis going on at two places in the tube, so the area between these two points of inflammation or healing and fibrosis will become an enclosed chamber, and there will be collection of, because of transudation and exudation, there will be collection of fluid that can lead to hydrosalpinx. Okay, so there will be hydrosalpinx, and that can be felt on pelvic examination or abdominal examination, and there can be tubo-ovarian masses that can be felt on abdominal examination. And in the advanced stages, as I have told you, pelvic adhesions, there are extensive adhesions which lead to frozen pelvis.